New legal redress officer, Tim Alexander, Esquire. And Tim Alexander really needs no introduction. He is a respected and distinguished civil rights attorney. If we had to pay him, we'd have to get money from Hawks to pay him. But he is going to be our legal redress officer. And we really need one in this day and time with all the things that are happening on the legal field. So he's here. Thank you, Tim. Thank you, Brenda. Thank you, Kristen. Thank you, Yolanda. So we will start with Kristen. After he finishes, and hopefully everyone will have a chance to read the minutes. We'll take a motion for the minutes, and then we will continue. Kristen.
Awesome. Good evening, everybody. So I apologize I wasn't at last month's meeting. Gymnastics took over for me and my daughter, so she had a competition, so I'm just here to support. But listen, I want to just update you all first. Did anybody attend Culture Fest 2 weekends ago on Kentucky Avenue?
Yeah.
Thank you for coming out. We're going to make it better and better each year. Atlantic wanted to take an opportunity to bring it back, just to get it started. We knew that it wasn't going to look like, I heard someone told me Aretha Franklin was there at one point in Kentucky Avenue Fest. I don't know if that's true or not. You know, people in Pacific Avenue tell you anything these days.
Thank you.
But nonetheless, we are looking forward to bringing that back again next year, and we're going to have more community involvement and more vendors. So I wanted to thank you all for joining that. So I'm not going to talk in depth about as President Shabazz, he called it the big ugly bill. President Trump calls it big beautiful bill, whatever you call it. Whatever we call it, right? There are some serious implications as it pertains to healthcare. As a hospital executive, I'd be remiss if I did not share that there is a direct implication to Medicaid and Medicare services. And so, how many of you know somebody who lives with Medicare or Medicaid? All of us. So, when you look at Medicaid, we're going to actually, Ms. Steele and I, she gave a great idea in our executive meeting, so I'm going to set up a time where we'll do a dinner where we'll just go over the implications, because there are some electoral pieces to it, such as our gubernatorial election that's happening in a couple of months. So there are some requirements from the state that they would manage some of the workforce requirements, all of that. But I want to just say that some of the things that concern me are the direct implications to Medicaid. We know that many people, particularly in Atlantic City, live with Medicaid, and there are opportunities in this bill to take that away from those people, the most vulnerable people, the people that need it the most. We are seeing even individuals being looked at as it pertains to screenings, right? If they don't have access to these screenings and things of that nature. So there's a lot to do with this bill. I want to take a lot more time than just 2 minutes to talk about it, but I want you to know it is on our radar as your branch to sit down and go over it thoroughly. I'm actually going to bring some of my colleagues who are physicians to talk about it as well, but I want to say that as of right now, if you have any questions regarding, please reach out to me. I do want to say that last year you all helped me with a COVID-19 disparities research. You got my email. I needed you to take some questions and things like that. I'm proud to say that Atlantic with the help of NAACP, we were awarded the Bridge Award, which meant we had the best research outcomes. So, I'm over here sitting like Denzel on the heater. Let me stand up like I got some sense. So next Thursday, the CEO of the American Medical Group Association is coming into town to present us with the award. We did invite some of our executive board meeting members to this presentation. Our CEO, Atlantic of course, will be there. But I think the main thing that I'm going to be saying to these people is that this would not have been possible without the involvement and participation of our Atlantic City chapter of the NAACP. So really excited about that. Last week, I hosted a sickle cell disease blood drive right here, actually in this room. And it was so impactful that I want to do something with the NAACP where we host one. Does anybody know anybody living with sickle cell disease? Horrible disease. When I'm rounding in the hospital and I see our people coming with that, it's horrible to listen to because they're screaming in so much pain. But one of the interventions that we have as a people to help them is blood drives. the quicker we can get them blood, the better it is for them as an intervention. And so we are gonna, I'm hoping that probably maybe in the fall we will host an NAACP blood drive that will go directly to sickle cell patients. I put a picture of myself. I had my own blood in my hand in a little bag, and someone told me that can impact 3 to 5 patients. So we're going to continue to represent, our sickle cell disease patients or those living with sickle cell disease, so we can help them. CareSpark, President Shabazz and I met with a gentleman called Keith De Acosta. He has done this for 4 years. He would have a health fair at the Showboat every October 4th to be exact. He's bringing it back. This is the 5th year. President Shabazz and I are really going to help him. He wants to have it at Pop Lloyd, which we're hoping that will happen. It will be an outside. I've told him that, having it at the casino is great, but you'll get more of the community connection if you have it outside. And so he is looking to have this October 4th, more to come, but I'm sure we're going to want to have voter registration at this event. There's going to be health screenings, eye exams. There's going to be pretty much a whole blitz on our community around health equity. So that's October 4th, and of course I'll send this out later. Hey, anybody know a doula? Anybody know a doula? Anybody know what a doula is? Okay. Doula, kind of like a midwife, a non-clinical midwife, right? So August 7th, I'm hosting a doula appreciation night. I'm calling all doulas, and I'm talking about real doulas, not somebody who think they're a doula. We all can be a doula, but I'm talking about the real ones. Atlantic Care on August 7th, we're hosting Doula Appreciation Night. This is my way, our way as a hospital to connect with the doulas in the community, because you will know or find out that a lot of times there's tension between doulas and clinical staff, providers, nurses, because sometimes those doctors and those nurses feel like some people are in the way. But everyone belongs in a room. And so one of the ways we're going to do this is we're going to have this appreciation night where we're calling all doulas. We're going to bring some of those providers out, just do a quick thing. But we're more so networking. We're going to give them massages. We'll do all of these things. But more importantly, I'm going to get those names on the paper so that I know who they are, so we can keep up to dating with them around the work that we're doing as a system, as a community, particularly with the NAACP. But also we want to know who these individuals are so we can support them as they're doing good work, because we want to see the maternal numbers go up as it pertains to black and brown babies and moms. So that's that. And then finally, Vinnie Kirkland. His mom is right here. So you can tell him I made this announcement. He's hosting his annual FQHC Community Health Fair right here on this campus, August 8th. Please, it's free, 12 to 4. We're going to be screening. We're going to be doing all types of things. And my last point, I know I said that 2 times, but this is it. If you know a child that needs a physical, that plays sport, please reach out to me. We have doctors, students under me that are looking to get into the community to provide free physicals. So if you know of anyone, please let me know. We're going to try to have them, throughout the quarter, but we don't want to have our kids missing out on opportunities because of maybe physicals not being complete at the right time. Does that make sense? That is all I have, President. I'm good to go.
Thank you, Kristen.
I appreciate the class. I appreciate that.